Hello, everyone, and welcome to this year's Employee Benefits Open Enrollment presentation. Today, we will be discussing your benefits effective June 1st of 2024 through May 31st of 2025. This year's open enrollment period will begin on April 22nd and conclude on May 3rd. It's essential to mark these dates on your calendar to ensure you have ample time to review your options and make any necessary changes. During this period, you'll have the opportunity to explore various benefits available to you, ask questions, and make informed decisions about your coverage options for the upcoming year. Employees will have the choice between two health plans, the first being TJ's Performance Plan and the second being TJ's High Deductible Health Plan compatible with a health savings account. Within each plan, you will find two columns, TJ Domestic and Anthem Retail. TJ Domestic accounts for services provided at a TJ Regional Health Facility, while Anthem Retail accounts for in-network benefits occurring somewhere other than a TJ facility. We will begin with the Performance Plan and compare the two networks as we work our way from top to bottom. Beginning with the calendar year annual deductible, there is no deductible for the domestic network, and there's an individual deductible of $3,000 and family deductible of $6,000 for Anthem Retail. The domestic network has a 90-10 coinsurance share with the member responsible for 10%. The Anthem Retail has a 70-30 coinsurance split. The medical maximum out-of-pocket on the domestic network is $1,250 for an individual and $2,500 for a family. Anthem Retail is a $6,000 for an individual and $12,000 for a family. The pharmacy maximum out-of-pocket for both domestic and Anthem Retail is the same, $1,500 for an individual and $3,000 for a family. Moving down the column to covered services, primary care visits are at $5 copay for domestic and a $30 copay for Anthem Retail. Specialist visits are at $10 copay domestically and $60 retail. Preventative services are covered at 100% both domestic and Anthem Retail, and emergency room copays are $150 for both networks. Urgent care is $25 domestic and $75 retail. Inpatient and outpatient services are at 10% coinsurance domestically and a deductible plus 30% coinsurance at Anthem Retail. The Performance Plan is the only plan that qualifies for the C-Care program, whereas the High Deductible Health Plan does not. Moving on to pharmacy copays, generic drugs are a $4 copay domestic and $15 retail. Preferred drugs are $20 domestic and $45 at retail. Non-preferred drugs is a 50% cost share within the domestic network with a minimum of $35 and a maximum of $75. Non-preferred drugs is a 50% cost share within the Anthem Retail network, but with a minimum of $75 and a maximum of $125. Moving now to the High Deductible Health Plan, TJ will contribute $500 to an HSA for an individual and $1,000 for families. 50% of the contribution will be deposited on June 1st, with the remaining 50% deposited on December 1st. The calendar year deductible for a single is $3,200 and $6,400 for a family. Once the deductible has been met, a 90-10 coinsurance with the member paying 10% will apply to the domestic network. For the Anthem Retail network, that coinsurance will be a 70-30 split. The domestic maximum out-of-pocket will be $4,500 for a single and $9,000 for a family. For Anthem Retail, it will be $6,000 for a single and $12,000 for the family. The maximum out-of-pocket accounts for both medical and pharmacy. Aside from preventative care, the domestic network for covered services will be deductible first, then 10% coinsurance. For the Anthem Retail network, it will be deductible first, then 30% coinsurance. Looking below at the pharmacy, once the deductible is reached, the drug copays will follow the same copay schedule as the Performance Plan. One benefit change this year pertains to rehabilitation services. TJ is proud to be able to increase the rehabilitation limit from 20 visits to 30 visits annually. This visit increase applies to physical therapy, occupational therapy, speech therapy, and pulmonary rehabilitation. Available to you this year is Anthem's new platform, Building Healthy Families. When you enroll in Building Healthy Families, you can count on personalized support at every stage, from family planning and pregnancy through the toddler years. Your profile is completely tailored to your needs. Depending on your situation, you will have unlimited access to tools to help you stay organized, health and wellness expertise for you and your family, and personalized pregnancy support. To enroll, visit anthem.com or log into the Sydney Health app. Find featured programs at the bottom of the homepage, select View All, and then choose the Building Healthy Families link. Flexible spending accounts, known as FSAs, offer you the opportunity to payroll deduct a portion of your income on a pre-tax basis. You may set aside up to $3,200 in an FSA. Qualified expenses include medical, dental, vision, pharmacy, and over-the-counter medications. While those with a high deductible health plan are not eligible for a medical FSA, they are eligible for a limited purpose FSA. The limited purpose FSA can be used for dental and vision expenses only. Plan year runs June 1st to May 31st and comes with a 60-day provision to file claims for the previous plan year. There is a rollover provision of up to $640. An FSA account is a use it or lose it account. Any dollar in that account in excess of $640 will be forfeited. You also have the opportunity to open a dependent care account. This can be used with either a medical plan or standalone. This account allows you to payroll deduct tax-free dollars to fund the daycare of children under the age of 13 or a disabled spouse, child, or parent. Annual maximum contributions is $5,000 for individuals or married couples filing jointly, or $2,500 for married individuals filing separately. Married couples have a combined $5,000 limit, even if each has access to a separate dependent care FSA. For those of you who elect the high deductible health plan, you may also elect to set money aside into a health savings account. As mentioned earlier, TJ Regional Health will contribute to your HSA on your behalf in the amount of $500 for single coverage or $1,000 if you cover dependents. Your HSA will be administered by Health Equity. HSAs are separate from your health insurance. Expenses processed through your health insurance provider will track towards your deductible and be eligible to be paid from your HSA. It will cover things like doctor and hospital visits as well as prescriptions. You own and manage the account. Funds accumulate year to year, and there is no use it or lose it provision that exists like it does with the FSA. HSAs are portable and go where you go. On the right-hand side, you'll see the 2024 HSA contribution limits. You may contribute up to $4,150 on a self-only plan or $8,300 on a family plan. There's also a provision that allows you to contribute an additional $1,000 for those over the age of 55. We will now discuss dental and vision benefits, beginning with your dental plan provided by Delta Dental. Individuals have a $50 deductible and families have a $150 deductible. Each family member carries their own $50 deductible, with $150 being the most you'll pay for the entire family deductible. You have a $1,500 annual benefit per covered member. Preventative services are covered at 100%, with minor services covered at 80% and major services covered at 50%. There is also an orthodontia benefit of 50% with a lifetime maximum of $1,000, and that is good for children through the age of 18. Looking now at your Anthem Vision plan, exam copays are $20 and material copays are $10. Contact lens benefit are available every 12 months with a $130 allowance for either elective or disposable contacts. This is a one transaction benefit, meaning the $130 is best used all at once to capitalize on the full amount. For example, if you were only to get $30 worth of contacts, the remaining $100 in benefit would be forfeited. Medically necessary contacts are covered in full. Frames allowances are available to you every 24 months in the amount of $130 plus 20% off any additional balance. Lenses are an annual benefit, good every 12 months, and are paid in full after the copay. When it comes to life insurance, TJ is proud to provide its employees with life insurance in the amount of 1 times your annual salary. Additional life insurance may be purchased through Symetra as a voluntary benefit. Employees can purchase life insurance in $10,000 increments ranging from $10,000 to a maximum of $300,000 with a guarantee issue amount of $300,000. If you are a new hire enrolling for the first time, you can purchase the full $300,000 amount without satisfying any evidence of insurability. If you are not a new hire and declined life insurance in the past, or have purchased life insurance but would like to increase your benefit amount, you will need to complete the evidence of insurability requirements that can be found within the UKG Open Enrollment portal. You may also elect to purchase life insurance for your spouse in $5,000 increments with a minimum of $5,000 and a maximum of $150,000. Spousal guarantee issue is $50,000. The same principle applies towards spousal guarantee issue regarding evidence of insurability as it does for employees. Additionally, you may elect to purchase $10,000 of life insurance for your children. Both short and long-term disability are available to you through Symetra. Short-term disability is voluntary and employee paid. While evidence of insurability is not required for new hires, it is required for those who have declined in the past. Short-term disability benefits begin after 15 days and are available for 11 weeks, providing protection for 60% of your income with a weekly maximum of $700. Long-term disability is paid for on your behalf by your employer. It begins after 91 days and is available until Social Security normal retirement age. It protects 60% of your income, but please refer to UKG for information regarding the maximum as it varies by job classification. Also available to you through Symetra is an accident policy. This plan pays for any injury, either while at home or at work, based on predefined treatment amounts. This plan pays directly to you and can be used for any purpose. Children's sports injuries are covered, and it comes with a $50 wellness benefit per covered person. The TJ biometric screening is a qualifying event for this wellness benefit. On the right-hand side, you can find a schedule of payments per accident. Employees have the opportunity to purchase a critical illness and infertility policy through Symetra. This plan pays a lump sum benefit after a covered condition is diagnosed. Some common examples are cancer, heart attack, stroke, ALS, MS, Alzheimer's, Parkinson's, and more. It is guaranteed issue up to $30,000 with dependents eligible for 50% of the employee benefit amount. There's a $50 wellness benefit, just like accident, and $100 if combined with accident. There's reoccurrence and additional occurrence with no maximums. You have the ability to choose 3 different options: Level 1, a $10,000 benefit, Level 2, a $20,000 benefit, and Level 3, a $30,000 benefit. Also included with the critical illness is infertility. Benefits are paid at 25% of the elected critical illness benefit amount. Each level pays 3 times with a 90-day separation. It requires 12 months of trying if less than age 35, or 6 months of trying if age 35 or older. There are 3 benefit levels: Level 1, oral and injected medication or IUI treatment; Level 2, IVF or surgery; and Level 3, ovarian stimulation with egg retrieval. Employee assistance programs are a valuable tool for all. Your EAP, provided through the Human Development Company, provides free counseling and life management services offered at no cost to you. The services are completely confidential, and use of services is not reported to your manager or employer. Your EAP is there to serve not only you, but your entire household. This is a standalone program and is available to all, regardless of enrollment and other benefits. For assistance during open enrollment and beyond, please reach out to Sarah Jackson at Houchins Insurance Group. Her contact, along with the contact for each carrier discussed in this presentation, can be found on the back of your open enrollment guide. I will now turn it over to Treva and Pam to speak about Fit for Life and open enrollment using the new UKG platform.
Hi, this is Treva with Fit for Life. I'm the coordinator at Fit for Life, and we are excited to announce a lot of new things coming up. We have recently moved. We are over in front of the pavilion at in the Hibbett shopping area. As always, we see minor injuries and sick visits for employees on our health plan, their dependents, and children over 5. Besides illnesses, we also do sports physicals for children, so don't forget about that. Be sure to check out our newsletter every Monday. We have lots of new events coming up, And also, we have a big announcements coming up in the next couple of weeks, and you will learn more about that in our town hall meetings.
Hi, this is Pam Gray, the benefits coordinator, and as everyone knows, we have moved to a new platform this year. Last year we did open enrollment, it was on Paylocity. This year it's on UKG. So there's a few things that I just want to go over. The things that I think may cause the most trouble. If you have any questions after watching this, you can reach out to me. My phone number is 651-4886, or my email address is pbray@tjsampson.org. So the open enrollment window will be opened April the 22nd through May the 3rd. It is a Monday and then through the following Friday of the next week. How you're going to do this is you're going to log into your UKG portal, and then on the left-hand side you're going to click on Life Events, and then you're going to click on Life Events again, and then you're going to click on 2024 Benefit Enrollment. And this is where you're going to start your open enrollment benefit enrollment. One of the first things that you're going to see is open enrollment, and you're going to either check make new elections or stay enrolled in current benefit plans. We highly recommend that everyone go through the open enrollment and check make new elections. If you check or click on stay enrolled in current benefit plans, it's going to keep everything you currently have and take you to the end to the confirmation page. You're not going to be able to review what you currently have. With moving to the UKG platform, some things may have been missed of transferring over. So that is why we highly suggest everyone click on Make New Elections. Also, FSA. If you want to enroll in the FSA Flex Spending Account, you have to go through open enrollment. That is a benefit that you have to enroll in each year. If you were enrolled in it last year, it will not automatically re-enroll you. You have to sign up. So we highly recommend that everyone do make new elections or check make new elections. One of the first pages you're going to come to is beneficiaries and dependents. So if you'll look at the bottom of the screen where I have marked out a name, that is where you're going to see who is currently listed under you as a beneficiary, as a spouse or a dependent, and then your emergency contact. I would suggest or recommend that you click on each person. If you have someone listed, make sure all their information is there, their date of birth, their address, their social security number. If a person is not listed there that you plan on adding to your health insurance, like a health, dental, and vision, life insurance, whatever, you will need to add them. An employee, a spouse, a dependent. When you go through this open enrollment process, you're going to come to your life insurance, group life insurance that the hospital provides. You must have a beneficiary before it will let you complete your enrollment. So make sure that you have whoever you want listed as your beneficiary listed at the bottom of this. A lot of beneficiaries did not transfer over from Paylocity because there may have not been a date of birth or a social security number. So look at who's listed there for you, and if you do not have your spouse or your dependents or your beneficiary listed, go ahead and click Add, the top right, and add that information. The next page that you're going to come to, or one of the next pages, is your medical enrollment. So if you look at where the blue arrow is at the top, current plan, if you click on that gray box, it is going to show you what you are currently enrolled in. This is going to be for all benefits. That gray box in the top right hand side, current plan, click on that and see what you're currently enrolled in. Down below under your options. So you're either going to say I decline, or then you're going to either click on medical performance or scroll down and click on medical high deductible. If you look at those options there, they have been shortened because we only had so much space to put right there. So if you look to the right where that arrow at the bottom is, read more, click on that, and that will explain what each one of those options are. So it has to do with engagement and then tobacco. So be sure to click on read more and you'll have a definition of what those options mean. One of the next pages is going to be your nicotine affidavit. So I would just tell you to make sure that the option that you choose matches your health insurance. So if you have an employee plus spouse option on health insurance, just make sure you acknowledge here whether you use nicotine and whether your spouse uses nicotine. There is number 6 that says not electing medical that you would select if you're not going to enroll in the medical plan. Short-term disability. So short-term disability and voluntary life insurance are 2 benefits that if you elect as a new hire, you're automatically approved. Short-term, you're automatically approved. Voluntary life, you're automatically approved to the guaranteed issue. If you waive those benefits as a new hire and you want to enroll during open enrollment, because open enrollment is the only time that you can elect those, you will have to fill out an evidence of insurability, an EOI. So if you are not currently enrolled in short-term disability and you want to enroll, you're going to click on short-term. It's going to show you what your cost is per pay period, and you will be prompted to fill out or complete that evidence of insurability. I advise all employees to click on the box on the top right-hand corner, current plan, and let's say you currently do have short-term disability. You then are going to have to check short-term disability because it is not going to automatically populate for you like it did with Paylocity. So you've either got to decline or you've got to enroll. With short-term disability, you only have one option, so that's fine. But like on health insurance, you want to make sure that you have selected the same option that you previously had, if that is what you want. Life. So I spoke about life insurance, employee supplemental life. This is one that you definitely need to click on the box, the current plan, and see what you currently have, because there's lots of different options you could have. Click on the box, see what you currently have, and then click down. It says supplemental life employee and put that amount. Now, if you want to enroll in more coverage than you have, that's fine. Just realize that if you enroll with more coverage, you're going to be required to fill out an evidence of insurability. If you choose less coverage, and you can, let's say you have 100,000 and you want to go down to 50,000, that's fine. You will not be required to do an evidence of insurability. But just please be sure, look at your current coverage, and then if you want to keep it the same, click on supplemental life employee and select that same amount, and you will not have to complete the evidence of insurability. This is going to be for a spouse too. If you currently have coverage on your spouse, and it will tell you if you click on that box in the top right hand corner what you have for your spouse. Make sure, if you want to keep it the same, you re-enroll, or click supplemental life spouse and enter the same amount that you currently have. If you want to increase that, and you can increase it up to half the amount that you have on yourself, if you increase it, you'll have to fill out the evidence of insurability for the spouse. So the key takeaways: if you select the make new options, which I recommend that you do to make sure that all your information is in there, you're going to have to fill out each benefit. Click on the box on the right-hand side to see what your current benefit is, and then make your election accordingly. Verify your short-term disability coverage. Be sure to click on the box to see what you currently have. And if you have it, you want to keep it, you need to click on it that you want to enroll. If you want to enroll for FSA for this coming year, 2024-2025 plan year, you have to re-enroll. And then voluntary life, make sure that your current benefits match the elections that you have.